I'm Diane Meschino, and I'm a medical doctor first and foremost, and a psychiatrist also by training. I have a position with the Women's College Hospital, which is the head of the reproductive mental health program. I'm also an assistant professor with the University of Toronto. Postpartum depression is really an umbrella term for a number of mental health issues that arise in the postpartum period or during pregnancy, and it includes what we think of as fairly typical depression, but it also includes anxiety, which can be even more prominent than depression in the postpartum period and can be extremely disabling. And we would also include in there OCD or obsessional symptoms, which are frequent companions of depression and anxiety. Depression is a very commonly used word, and we all use it a little bit differently. Certainly in the field of psychiatry, we refer to it as a disorder of mood, and often a disorder of energy that has companion symptoms affecting one's concentration, often one's appetite, ability to sleep, very prominently one's ability to experience joy and pleasure, which we see very much in the postpartum. I know, I've always wanted a baby. Now I have a baby and I can't enjoy this experience. What's wrong with me? So that's what we mean by depression. It's not just purely sadness, and sometimes women won't necessarily feel sad. In terms of anxiety, which I think is really important for people to understand, because anxiety is such a common symptom. We all have it. If we're normal, we all have periods where we're anxious and worried. And in the postpartum, that can be escalated to the point where women can't shut off their minds. It's going around and around and around with worry. They cannot turn it off. They cannot sleep. Often people are saying, well, 4 or 5 hours. Not the women postpartum. When they say I can't sleep, sometimes they're getting minutes a night or an hour a night. And this goes on for weeks and months if it's untreated. Worry, panic, a lot of somatic or body symptoms, heart palpitations, and generalized sort of feeling tense.